premium. They cheated us. And that's government money that is being used. So I think even if it can't answer now, it's something we need to look at for the future.
Really?
Yeah. Thank you, Madam CS. Mine is just an input on that. I am thinking that the social insurance should cover for the first loss. Then the private insurers should be able to bring down their premiums because the first loss is already covered for by the social insurance. And we need to protect our customers by you, through policy, ensuring that the premiums come down as opposed to them going up.
Chair and honorable members agreed, and equally agreed to Honorable Onyikal that I need to find out. I will find out, Mheshimiwa. Thank you. Now, on the, I don't know whether I should respond to Mheshimiwa Cynthia now that she has stepped out. I respond. Okay, she's not there. But let me highlight something regarding payment to private and public, because I think for the it's good for the committee to know. Why do people move from public facilities to private facilities to seek services? It's because of an availability of service in the public facilities. So what we have done under Social Health Authority is, one, to ensure that the public facilities have the service. And one is to ensure that the commodities are available. You know, we have done the reforms at KEMSA. We now have a high fill rate. We were with the Mheshimiwa Honorable Nyikali in Kisumu. We looked at the fill rates. They are on a good trajectory. They are moving up. So what we want to ensure that at least commodities are available. Number two, equipment for diagnostics and other testing. We are also working together with the counties to ensure that the facilities are equipped. There's a program that we are working together. And number three is the availability of health workers. And I think that is what we are dealing with at the moment. We have to ensure that health workers are available in the public sector. What we have at the moment is we have a shortage, and that we must confront as a country, and especially this committee that is in charge of healthcare. We must confront that we have a shortage of health workers. And that is one of the reasons that has put us in the quagmire that we are in right now with the intern. So we must see, how do we raise resources to ensure that public facilities have commodities, have equipment, have health workers. Once those three are available in public facilities, I can assure you the numbers and the traffic of people to private will reduce. It will be a matter of preference. So that is what we are trying to do under the Social Health Authority, to ensure that then public facilities are able to provide services, so that then we turn the question, more of payments from Social Health Authority then go to public facilities vis-a-vis private facilities. But it should all be dependent on availability of service. I think I have responded to Mheshimiwa Mary on the competing interests. About the patients at Madari, I am aware. I did visit Madari Hospital myself. And I got to interact with those who have recovered. And I actually took phone numbers, because some of them even have telephone numbers of their relatives. And from my office, we called the relatives and said, your patients have now recovered. They are at Madari. But, Chair and honorable members, people are not willing to take back their people from Madari Hospital. So then we have to see what is it that we do as a country, whether to have a home or something where these patients who have recovered then can be taken to continue serving the country in other capacities. Maybe we can build a school, we build a training institution in there, so that then they get involved and see how back they can be, whatever, back into the society, reintegrated back into the community. Otherwise, we have a problem that Kenyans believe that if anybody is at Madari, then they do not even know that if they have recovered, they need to go back to the community. That is a solution that then we must be able to resolve, all of us together. As a ministry, we have plans on expansion, and subject to availability of budget, We should be able to expand Madari outside its current situation, and wherever we will move it to, we should be able to prepare like a social home or something where then those can be reintegrated back into the society. Honorable Bishop is on deductions and services, and I like that you acknowledge that in the developed countries, health insurance is mandatory. In fact, you can miss something else, but not miss payment for your health insurance. So I would want to seek that Kenyans we get into the same, that we pay. And therefore, for my role then as a minister is to ensure, how do I ensure that the resources that have been raised are put into good use, that we optimize the use of those resources and ensure that there are no leakages, so that, as we have rightfully said, and it's my commitment, that once we collect what we are able to collect under Social Health Authority, we should not have those WhatsApp groups for collecting, for doing harambes, the one that has been referred to Honorable Cynthia. But that is not going to be a walk in the park, Chair and Honorable Members. Number one, to enforce collection. Once we have enforced collection, then it is to use the system that we have put in place. And that is why from the word go, we are putting in a digital system, just to ensure that we are also able to trace these monies as they move through the system. So for now, I can assure you, Chair and Honorable Members, that we have plans to ensure that we put resources to good use. We have plans to ensure that there are no revenue leakages, there are no losses from the Social Health Authority. So it's to ask that then Kenyans register and pay up, so that then we actualize the plans that we have. The last question from Honorable Passaris regarding waivers. Unfortunately, that is the situation that we are in today. Honorable Mary here sent me a request to waive a bill. And Chair, she will tell you that I told her, how much can the family raise, to what extent, so that we are also not just waiving. Because we then leave the institution with something, with a debt that they cannot be able to fulfill. I pushed Honorable Mary and I told her, the day you'll tell me how much this family has been able to raise, then we can discuss the waiver bit of it. But it's a responsibility for all of us really to see what is it best that we do to ensure that we minimize these waivers, because they contribute to the institutions not functioning properly, because they have to do budgetary allocations for waivers. Having responded to all questions, Chair and Honorable Members, I would like to highlight one thing, and I think Honorable Passaris also put it out. When we budget, it is expected that we shall receive those resources. But as and when we receive resources, then we do not count it as money that we have. Like the deductions that are already done for NHIF. If you look at the budgets, they are done, yes. But have we received the exchequer? We have not received. So until as a country, then we move our budgeting process to a way that when we budget, then the resources are actually available. Exchequer is actually available to meet that. That is when then we can hold these institutions to account and say money was deducted, but service not provided. Chair and Honorable Members, I submit. Thank you.
Chair, can I request to make a comment?
Before you make anything, I think, Madam CS, for those of us who have been in this space for some time, in 1980s, Kenyatta Hospital was the best hospital in the country. That on 9th and 10th floor used to be the civil servants' wards. I'm sure under your stewardship, we shall get back to that. That will happen, and
I admitted ministers.
Yes. Everybody, the hospital of choice those days was Kenyatta, and there's no reason why that cannot happen today. And if you focus on it and you want to go there in that direction, you will make it. The issue of waivers, I know, is very complex. There are lots of people in many institutions where people have left ID cards and titles. It is just filling the office. They go and report that one as lost item and get another copy. At the end of the day, the hospital is the one that loses. I think...
I wanted to say something about waivers. Chair, I had a request to make a comment.
And Nyekali wanted to overtake you. Do it.
Thank you, Chair. Madam CS, I have two concerns. One is the indignity of our people who are detained in hospitals after having accessed services. Yet we have social protection programs, and I have not seen any attempt by the ministry to lay claims to funds under social protection for Kenyans who access health services, are detained in hospitals because they have no ability to pay. And I would like to see a deliberate move by the ministry towards cushioning. Because even when SHIF that is supposed to come and cover everybody, there's still the question of historically those who are in hospital occupying hospital space, incurring bills for boarding without receiving treatment. And it's a form of imprisonment. It's inhuman. In my view, it's a violation of human rights. What do we do about it? Because we are the ministry that is responsible for policy. What is our direction? The second one is how the Treasury and the salaries departments in ministries and sagas, having deducted contributions from salaries, end up delaying remittances to NHIF to pay service providers. What is our position as a ministry on that issue? Because as long as people feel that late payments, there is punishment for individuals, but there is no punishment for corporates, government ministries, and government agencies. This violation, even with coming in of SHIF, it will still continue. And we'll have the Social Health Authority again in the exact same position that NHIF is in today in terms of timely payments for services to hospitals and other service providers.
I think, Honorable Madenge, the CS said she was in Treasury this morning trying to sort out the same thing.
Yeah. You see, going to Treasury is a stopgap measure. So is that what we'll tell Kenyans, that we'll keep going to the Treasury? I have asked a fundamental question. Parliament has deducted my NHIF from my salary, my contribution to NHIF. Why should the Parliamentary Service Commission delay in remitting that money to NHIF? And what is our position as the Ministry of Health?
I think the CS, you can quickly comment
Chair,
as I release you to leave.
Thank you, Chair. I think I had, Honorable Madenge, I had responded to that before you came. I said under the Social Health Authority, one of the changes that we have done is deduction at source for Social Health Authority. That the remittance, for example, of Parliament, instead of Treasury forwarding money to Parliament, for Parliament to deduct and send to Social Health Authority, our Social Health Authority funds shall be deducted at Treasury and sent to Social Health Authority without coming through Parliament. So that then we cut that link of delay. And it's not just Parliament. Many government institutions, they do statutory deductions, but they delay to remit to NHIF. So under the new laws, it will be at source that Treasury then sends the money for SHA to SHA and sends the rest of the money to other institutions for them to take care of the other of the things. So in terms of enforcement, again, Treasury will tell you is a matter of availability of exchequer. Chair and honorable members, this committee is the one that gives resources to institutions under the Ministry of Health, including if they are supposed to be resources for social protection. The last budget that we did, Chair and honorable members, to this committee, you know that we have a gap of 97 million from what we requested and what.
Let's not go in that direction.
So, Chair and honorable members,
members, please, I kindly ask you to remain behind. The minister is
Chair,
free
Chair,
to
I'm
leave.
going to ask about
No, you will ask him. The minister, you are free to leave.
No, Waziri, I'm asking this. No. I want to ask about Stephensis. There is a very fundamental issue, Chair. This report starts by saying the molecular analysis conducted on the recently discovered invasive mosquito has confirmed its existence, but examination of the sporozoites to assess malaria transmission by the vector has yielded negative results. And often specimens collected from the specific counties have shown no evidence of being infected with malaria. Now, everything we are putting in place is on the assumption that Stephensis is transmitting malaria. But our very statements start by saying it doesn't. Now, the only thing we have, Chair, is that we are going that in Ethiopia and Djibouti, it is known to transmit malaria. Now, we are therefore put with a bigger problem, not of developing programs, but of actually detecting whether the Stephensis in this country is the same as Stephensis in every country. We know, Dr. next to you knows, that there are very many mosquitoes that actually don't transmit anything, don't even transmit other diseases. For example, Rift Valley fever is mosquito-borne. It is rampant when it came, it was in Mazabit. So my question is, are we developing a program on the basis of an assumption, or are we also going ahead and doing research at molecular level to know whether the Stephensis we have in Kenya is actually transmitting malaria? Because that's the basis of the whole question. If that is not true...
The Deputy Director General is an epidemiologist by training. I think we might, if you don't have adequate answers, we'll call you back to the committee.
Thank you, Chair. I think the starting, what Dr. Nyikal has read is actually pointing towards the continuous analysis and research that is being done to make sure that, one, the vector is present and it was confirmed to be present, but also to see whether it's carrying the parasite that causes malaria. And that is what we have seen. It is not causing. At that point, the research was done. It is not causing. The quarterly surveillance that is ongoing for this vector and the parasite is actually to have a continuous way of looking and detecting the presence of these parasites. The program, malaria program, is there because we have malaria. It is not started because of Stephensis. So it is just expanding the surveillance component to make sure that in the areas where the vectors are detected, we have continuous surveillance to ensure that whether it is carrying the parasites or not, and whether, and you know, Dr. that Stephensis also carries Vivax. Because we are doing, so we are also looking at that, because then it will mean that we have to also add Primaquine into the treatment schedule. So this is continuous surveillance to make sure that we are monitoring the vector itself, the types of parasite it is carrying, if there is any, so that we can be able to provide the guidelines for treatment appropriately.
So the bigger issue actually would be, because there has to be, when you are looking at malaria, and forget, don't just about, there is a statement which was saying that when there is unexpected, consequently, if there is an unforeseen rise in cases, regardless of the definition adopted by the country, and Stephensis should be considered a potential culprit. Now, that statement has huge cost implications because as it means that when you are seeing malaria rise, when I started practicing, it was not that Nairobi was not a malaria transmission area. That is not so. So these things are changing. Even areas where malaria now is.
Order, Dr. Nyikal.
No.
Order.
That order will not
Order.
take. Now,
Order.
you know, we are here to actually serve the country. And actually, of all the things we have said, to me, this is actually the key area, how the ministry goes about it. We can spend a huge amount of money, and at the end of 10 years, people come and tell us, all along, the Stephensis in Kenya was not transmitting malaria. So they have to answer so that what is afraid of is Waziri, whether we are asking you whether the strike is on or not. I'm asking, because that's what you are afraid of. Now I'm
not afraid of anything.
Now I didn't want to ask, but because of you now I'm asking, is the strike on?
The meeting is solved. You are free to answer the questions.
If you had left me alone,
Members, don't go.
But Daktari, think of my question. That is because you can't.
Members, don't go.
Don't come back.
But that is where they should put the money.
Simgemfuata huko.